Okay, this is June 12th, 2009. Donald Thigpen's past, present, and future speech. We have 5 people in the audience. This is his stage.
This is our speech for past, present, and future. What we'll do is show you something from past, present, and future. First thing I'll show you is a paramedic textbook. I came to Iraq as a remote duty paramedic. I have 8 years of experience around the Houston area, most of that time in Greenspoint, doing some urban EMS. Also spent some time at Liberty County EMS doing some rural EMS. I graduated high school at 17, entered into the paramedic program, became a paramedic in 19. The only problem I had was I couldn't get a job until I was 21 because of insurance purposes for driving. After the experience that I gained in Houston, I was able to qualify to come out right to the KPR. Currently, our job function here is a little different than what you find back in the States. Back in Houston, we did mostly emergency response, 911 response. We would respond out to 911 calls, pick up the patient, take them to the hospital, drop them off, never hear from them, never talk to them again. Here we have a little different of a job responsibility. We function more of a primary / urgent care capacity. So we do a lot of dispensing of antibiotics, which you see here is azithromycin. This is one of the antibiotics that we dispense. We, in addition to some of the more advanced level assessment techniques we were trained on, we do the antibiotic dispensing, we do suture removal, incision and drainage of abscesses, things of this nature. I've been here for a total of 8 months. I'll probably be here for another 4 or 5. And then we'll demob and go back home at that time. The last thing that'll show my future is over the last 2 years I've been pursuing the nursing program as seen or as given by Excelsior College. It included 7 of the paramedic to nurse transition courses, as well as 1 clinical called the CPNE, or the Clinical Performance and Nursing Examination, which is basically 1 weekend clinical test. There wasn't any training involved, it was strictly an examination. I was able to complete that and pass in March of this year. I've officially been granted the associate's degree in nursing by Excelsior College, and hopefully we'll take the NCLEX in July, and if I pass, then I'll be licensed as an RN as well as paramedic. Puts me in a great position once you get back home, opens a lot of doors. You know, nursing as opposed to paramedicine gives you a lot of options. You can get involved in ICU nursing, emergency room nursing, operating room. There's just so many specialties in nursing that you don't have being as a paramedic. So the past was the paramedicine, the present was the remote duty paramedicine that we do here, then the future is the nursing. And that concludes the exam. Do we have any questions?
What's the expiration date on your medication, sir?
The expiration date is irrelevant, ma'am, because this is for display only. It's not for usage for patients. Any other questions, ladies and gentlemen?
I have a question. What is your greatest
Female that you've ever slept with?
oh, sorry, we got to delete that. Your greatest achievement and your greatest disappointment about spending the last 8 months in Iraq at 112 degrees at 9 o'clock at night?
Without a doubt, it is meeting Maureen Rollins. Thank you for your time.